Øyvind, let's just cut to the chase right away. Why is Epstein-Barr-virus so central when it comes to multiple sclerosis, and why now?
Yeah, so it's a very good question, Martin. And actually, we think now that it's virtually impossible to get multiple sclerosis without first being affected by the EBV virus. And the reason why we are so sure about this is because of recent evidence that has come out from our colleagues at Harvard working on EBV and MS, especially the group by Professor Alberto Askerio and two of our former PhD students, Mariana Cortese and Kjetil Bjørnevik. They published a couple of years ago a paper in the journal Science, maybe the leading journal in the scientific field, showing they followed a lot of military personnel and showing that it was those who were not affected by EBV did not develop multiple sclerosis. So that was basically what they saw, that without the first infection with this virus, people did not develop the disease. So now we think it's a causal effect.
So we can maybe see that Epstein-Barr-virus or virus or EBV infection is necessary, but not sufficient to get multiple sclerosis.
I think that's a good formulation. Yeah, I think I would also say, so we think more and more that MS is a seldom occurring complication to the virus. That's also a way to look at it. It seems like it's impossible to get MS without the virus. So you get about 30 times increased risk after infection, you could say, if you want to put it into a number.
And I think it's also very important to mention that if it's hard to remember that the virus is called Epstein-Barr-virus, we can also call it everybody's virus, because 95% of all people in the planet are infected with this virus. Yeah. So it remains to be a big question why those people who get MS get MS.
Yeah, and it's also important to mention that most people who are infected by the virus do not develop MS.
Yes.
You need to have the virus, but there are also other things that need to occur to get the disease.
So we are trying, by using clinical trials, to find a way to target Epstein-Barr-virus, and by that do something with the cause of the disease. There are many ways of targeting Epstein-Barr-virus. We can use vaccines, for example, for prevention. We can both prevent Epstein-Barr-virus infection with sterilizing vaccines, or we can use vaccines which they don't prevent EBV infection, but infectious mononucleosis, which is closely associated with multiple sclerosis risk.
Yes.
We can also use cell therapies, using T cells, T lymphocytes, to target EBV-infected cells. And of course, we can also repurpose elderly antiviral therapies to target the virus. So what do we have some clinical studies, what we do in EBV-MS?
Yeah, we have started some clinical trials, and we are just finalizing some of the trials also now. We have tested one potential candidate, what's called tenofovir. It's used against HIV and against hepatitis B today. So it seems to also be quite effective against Epstein-Barr virus. It has not been tested against this virus yet, but we have tested it now in a trial on MS patients, and we are also testing it in healthy controls in a higher dosage than are used in HIV and hepatitis B. We think that we need a higher dosage against EBV. So that's very interesting, and I know that you are also doing a trial in this project.
Yes, we are doing it together.
Yeah, we're doing it.
Where we are going to investigate whether giving tenofovir, this antiviral medicine, can affect the pathway of MS and maybe reduce neuronal loss in patients with MS.
Yeah.
Is it complicated to do trials like this? What do you think?
It's quite complicated. It takes a lot of resources, but I think we have a lot of experience with clinical trials now, and we have a lot of experience of working together. Now we have done trials before, and you have also done a lot of trials in this disease. So I think we are very well equipped to do this.
Can we just, for example, compare antiviral therapy to regular disease-modifying therapies, or do we have to use them as add-on treatments?
Yeah, I think it's very, very difficult. Very many of the treatments we have today are very effective against MS, and I think it would be quite unethical to withdraw effective treatments when we don't know if this antiviral therapy actually can be used as a medication. So I would suggest that we use it as an add-on therapy, and that's what we are also doing. So we are using this as an add-on to existing effective treatment, and those who do not have a good enough effect of what they are receiving.
And when we use the word effective treatments, we mean that those treatments, what we have today, the high efficacy DMTs, they are potent against inflammation. But this type of therapy, what we are trying to investigate, it might be effective against the cause of the disease.
Yes, so we try to affect the cause, which we think is the virus, and the viral stimulation of the immune system.
Yeah. So it's really leading us in a new era of MS treatment, hopefully.
Of course, if this works, it will be a revolution for how we treat the disease.
And we are very happy and we feel very privileged that we are able to do these studies. We would never be able to do this without the support of our patients, our partners, the European Multiple Sclerosis Platform, and of course, funding from EU Horizon program.
Yes.
Thank you for listening to us.